about plastic surgery.
No.
Let me put it another way. Should you have some plastic surgery?
You should.
I'm going to ignore that. We asked Ash to find out more.
Plastic surgery can be reconstructive, cosmetic, or sometimes plain catastrophic. Celebrities around the world have jumped on this bandwagon to either boost their career or to simply hold off aging for a tiny bit longer. This is not a bad thing, as long as it is all done tastefully. Today I'm meeting Dr. Maurizio Viel from the London Centre for Aesthetic Surgery, who has graduated from the University of Milan and has been in the profession for over 20 years. Dr. Maurizio, plastic surgery has become such a big thing in today's world. The power of the knife is just unbelievable.
Yes, you're right.
So how would you define plastic surgery as?
The plastic surgery is an art, first of all. And to give the best result possible, you, the surgeon, has to be a good concept of beauty and especially of proportion. And then if you do that, you can give the best option to the patient to improve the quality of life.
Okay, now what, according to you, would be the pros and cons of plastic surgery?
You see, plastic surgery can enhance your life, but also can destroy your life. So it's important that when you go to the plastic surgeon, you must have realistic expectations, and also the plastic surgeon has to be honest and explain to you which are the downside, which are the problems, which are the complications, because you don't want to end up having troubles, having problems that can destroy your life.
Right. Yes, when you mentioned about the cons, I was reminded that a recent study, while I was doing my research, showed that bad plastic surgery has resulted in severe depression, ended careers, even increased the suicide rates. So what is your take on that?
Yeah, that's perfectly true. In fact, when we perform an operation, we don't have any rooms for mistake. And we must deliver the best job possible all the time. So for us, it's a lot of pressure. And also for the patient, they have to realize that going to the plastic surgeon is not just like to go to the hairdresser or to have a facial. There are some risks involved. And our duty is to teach the patient and to tell the patient which are the risks, the possible complications. So we must have a proper understanding with the patient which are the pro and the risk.
Okay, Dr. Maurizio, I have a bit of a challenge for you. Are you ready for that?
Ready.
This envelope right here has pictures of celebrities who have done plastic surgery, who haven't done, the best cases, the worst cases, everything. So I want you to pick out the best plastic surgery case and the worst.
I can recognize here Megan, that to me is most probably one of the best.
Definitely.
Yeah, and we know that her nose has been
she's done her nose.
And
think
you
she's
can see
even
that in a beautiful example how plastic surgery can enhance already a beautiful face.
So you would say that Megan is the plastic surgery wonder?
Yeah, definitely.
Okay, so we have a winner here.
That.
What about Hayley Montag? What do you think of her? Her lips look
yes,
so
but
rubbery.
I think that next to her there is another famous lady,
LaToya.
LaToya, that to me that's definitely the worst.
LaToya is the worst.
Yeah.
And why do you say so?
Because again, the nose has been done and it's too pinched, too artificial, too narrow. The cheeks are too full, and she looks not natural. She looks
Scary.
artificial, scary.
All right.
So yeah, definitely that's to me the worst.
So you would say LaToya Jackson is the worst plastic surgery
yeah,
case?
I wouldn't do something like that. Let's put it this way.
All right, so we have a winner, a clear winner, and of course the winner for the worst. At the end of the day, we all want to look like $1 million, but is plastic surgery worth it? The debate is still on.
Welcome back, and we're here with renowned plastic surgeon Dr. Maurizio Viel. We saw you there on the video giving our friend Ash just a bit of advice. Great to have you with us on the sofa to shed a little more light on the world of plastic surgery. If you had to say, what would be the most common procedure you're seeing coming through the door here in the region at the moment?
Here in the region at the moment, the most common procedure is liposuction.
Okay.
Because there is a need for body reshaping, and nowadays liposuction is much easier, much safer than what used to be. Sure. And that's #1 procedure in our clinic, and also in the Gulf region is definitely the #1.
Is everyone, I mean, any client that comes in, obviously you're going to give them advice.
Yeah, absolutely.
Are there some people who you can just say, look, you don't need liposuction?
Yeah, because sometimes liposuction cannot go on their own. you need to change lifestyle. So you need to diet and exercise. So if you're extremely overweight, it's silly if you come
So
to
it's
me.
not as simple as just going in, having the
No.
surgery done, and you're perfect.
There
You
is
have to
also something
actually-
important point to say that a lot of people
Yeah.
they also misunderstand that liposuction is not for losing weight.
Right.
Liposuction is for body reshaping.
Yeah.
So I can reshape your body, I can make your body looking better, much nicer, more in proportion. But if you need to lose weight, there are other operation or other treatment or other medical treatment or different lifestyle that you need to change.
So in a city like Dubai, where we have so many options when it comes to cosmetic surgery, how do you choose a reputable one?
This is a very important question because when you want to go to a plastic surgeon or cosmetic surgeon, you must have the reputation has to follow, has to precede this particular surgeon. And it's always important also to have some word of mouth. Ask your friends, your other doctor, refer from other doctors, and don't go and just look on the back of the magazine what is the advertising there that say, oh, go there because maybe it's cheaper. Then you don't choose the plastic surgeon in this way. You choose the plastic surgeon because you heard about him, you know that your friends have been there, and then when you go to see him, you must feel comfortable with him.
Yeah.
Right.
You must feel that you can trust him because
Sure.
you're going to give him your face, your body, everything. So you have to be in a mutual relation that of trust between the doctor
Absolutely.
and then the patient.
You mentioned a little earlier how accessible plastic surgery has become. Let's just work through a few procedures if we can. Maybe
Okay.
you can give us some ballpark figures, some examples as well, starting with
Yeah.
the all-important facelift.
Yeah, facelift is the king of operation in cosmetic surgery and plastic surgery because everybody see your face. Okay, so nowadays we can do a facelift. We call it a max lift. It takes 2 hours, and in 2 hours, then you can have a completely new, natural look of your face.
Right.
And when we do a facelift, we don't only lift the face, but we also lift the neck.
Yeah.
And this procedure are done under sedation. Is no longer done under general anesthesia, and that is a very good procedure that gives excellent results.
It's
And
not-
I think
it
we
is
have some
under-
examples right here of a
Oh, yes.
well-performed facelift.
Yeah, this is a facelift that include also a max lift, the neck lift, and as you can see here, this you can achieve the result like that in 2 hours under IV sedation, and then you leave on the same day the clinic.
And how much does a surgery like that cost?
This surgery costs around 40,000 dirhams altogether, all inclusive between the clinic, the hospital, the anesthetist,
Right.
everything.
Okay. And the next surgery we have images of is a cheek fat implant.
Yes, okay. That's because this is very important. It's quite interesting because this procedure of the injection of fat into the cheeks can precede the facelift, and it can put the facelift on hold for a few years because one of the first signs of aging is the lack of fat in the cheek areas. So if we can plump it up with your own fat together with stem cells nowadays,
Right.
so the fat is going to be lasting forever, you can have a much good rejuvenation with a minimal invasive time.
Now listen, obviously we've only had a chance to talk a couple of them. There are a number of other procedures.
Yeah.
I sent you over a little earlier on this week
Yes.
some pictures of
correct.
Saba.
I saw also your picture, by
Really
the
Should
way.
I be scared,
So
Dawn?
before we go any further, just tell Saba, come on, it's fine. She's hard-skinned as it is. Just tell her
I'm a big
what
girl.
she needs done. Let's
I
have a
can
quick
take
look
it.
at
You can
look at
take
Saba.
I can
everything?
take it.
Okay. I can tell you that, in my opinion, you don't need absolutely anything. You
Oh,
have a beautiful features.
Dark.
But there is a but here. You have to maintain this beautiful look, a beautiful complexion that you have. So sometimes it would be nice to do a little bit of prevention, like Botox injection, like a good mesotherapy to the face, like
At what
PRP.
age would you recommend that, though?
No, straight away.
Yeah.
Maybe we can
Listen,
start. We can start tomorrow.
Just you wait, Tom.
Yeah, and any time is important. But I think you start around in the late 20s, early
Yeah.
30s. That would be the right time to prevent
And,
with a very natural look.
And we also have Tom's picture for you. So I know
Oh,
you got a
really?
chance to look at that one as well.
Unfortunately, we've run out of time.
And
I don't think so.
sorry, you're not getting get out of
No,
this one
Tom.
that easy, Tom.
I can see
Oh,
Tom
well,
there.
Saw Tom.
Tom is a very handsome man, and he's got good features there. But if I will see Tom maybe in 10 years or 5 years' time, he will have a very deep line in the forehead. So I think that I
Oh.
suggest a bit of Botox in the forehead just to
Just a
prevent
couple
those lines.
injections. Right
It's
there.
not. I mean, it's not
Boom.
painful, and you will look absolutely perfect.
And you look younger in 5 or 10 years'
It's
time.
okay, Tom. It's okay.
I'll take
We
it on the
still
chin.
like you.
Don't worry.
I'll take it on the chin, and I'll have a chin job as well and things like that. That'd be good. But, no, Doc, it's been great. Listen, just before you go,
Yes.
every evening I go home and I have to sit through another episode of Nip and Tuck. Is the world of plastic surgery really like they portray in Nip and Tuck?
That's Hollywood. And Dubai is not Hollywood, London is not Hollywood. That's unique for Hollywood.
Dr. Maurizio Viel, it's been an absolute pleasure. Thanks so much for
Thank
your
you
time.
very much. Thank
It's
you.
been very informative and great advice.
Thank you.